This is The Cannamom Show, a podcast chronicling the inspiring stories of real women in the emerging cannabis industry. Your host, Joyce Gerber, mom, lawyer, political activist, has been speaking with women from coast to coast and around the world who are leaders in the revolution of cannabis and caregiving, continuing on her mission to lift up the stories of the women creating the cannabis industry by sharing their canna stories with you. So go make yourself a cup of tea or roll yourself a joint, sit back, and learn something new about this magical plant on The Cannamom Show with Joyce Gerber.
From the Tip O'Neill Studios in North Cambridge, Massachusetts, it's The Cannamom Show. Now here's your host, Joyce Gerber.
Welcome back to The Cannamom Show. We are so grateful you're joining us again today as we continue in our mission of crushing that stigma around cannabis and caregivers. Happy New Year, Dave.
Happy New Year to you. How was it?
It was good. I stayed up till midnight. I did it.
Good. Congratulations. Yeah. At our age, we got to congratulate ourselves for that. Yeah. I was at a small, like a house party, and there was no ceremony at all.
What?
We were doing karaoke, and I was the one who had to I volunteered to schlep the equipment so that of course, I'm Mr. Microphone.
Yeah.
Being the podcast guy. People just kept singing karaoke, and someone was like, "Hey, 3, 2, 1, Happy New Year," and they just kept saying.
All right.
I thought it was weird, but whatever.
I think that's fun. Karaoke to bring in the new year. I love that idea. All right.
Yes.
All right.
There was a lot of bad singing.
A lot of singing. I think that's funny. All right. There's no singing. I did do a little dancing. I don't know.
Nice.
I don't mind New Year. It's like a good reset. And I redid my office. And if anyone's actually watching me on YouTube, I switched it around. My husband helped me clean my rug. That is a good quality, ladies. A man who will clean your rug.
For real. Yeah. Like actual more than vacuuming,
He actually
scrubbing?
purchased a steam cleaner a while ago, like years ago, because we had an old dog and whatever their issues. But now we have it, and he And my daughter,
hardcore.
when she was like 9 or 10, I let her get a white rug. I know no one's seen it. I don't know why I would let a child get a white rug.
Yeah. Might not have been the best choice for a color.
I didn't even smoke pot back then. I have no excuse except I was just really busy, I think. And she's like, "I want this." I'm like, "Yeah, fine, whatever." So that's a good quality. And then I just before I do have a special segment guest I'm going to talk about in a second, but I don't know if you remember my friend from the Ukraine, Tia Moskalenko. We interviewed her in May of 2022. Things are getting actually worse in Ukraine. I don't know if anyone follows the news that well, but she sent me a message. She's looking for work. She sent me her resume. She does social media. She speaks English perfectly. And she was doing some copywriting for Ask Growers site, but I don't know anyone listening. Reach out to me. She's looking for some help. I don't know if I can, but I said I'd give her a mention and let people know that she's looking for work.
That's very nice of you. That's a mitzvah. And I hope somebody chimes in.
Me too. All right. Another mitzvah. So I have my friend Lisa, who I can't believe hasn't been on here before. She's a nurse in Connecticut, and she is going to be introducing her latest creation, Mindful Metrics Conscious Cannabis Consumption Tracking Journal. So she says, whether you're a seasoned cannabis user or just a beginner with your exploration, Mindful Metrics is your key to understanding and optimizing the therapeutic potential of cannabis. It is designed to empower you to achieve the relief and results we all deserve. So she's going to talk to us a little about what it is, and we talk a little bit about this, tracking strains, being conscious, and she's put this together in a journal for us.
Very cool.
So we'll be talking a little later in the show. And I do have a culture corner just before we jump right in with our guest today.
All right, let's do it.
The Culture Corner.
This makes you laugh every time. I don't know why. My life is small.
Just feel cultured when you hear that music.
It's like watching The Crown.
Right.
So today's Culture Corner, I want to recommend like a mini series. It's like a documentary series. I don't know what they call them. It's the Charles Stewart case. Remember from 1989? He murdered his pregnant wife here in Boston, set off a whole series of horrible, terrible, racist things in Boston, which, whatever. This is what the series is. It's sort of like going back in time and talking about the story, kind of the parallels of the story. And he set us up, basically set the Bostonians up to believe this really tragic thing that we did believe for a while, and it wasn't true. And I think it's 3 or 4 parts. It's called Murder in Boston. Like, what do you remember about that? 1989.
Yeah, I remember it was a wild case. Big news in Boston. Did he claim it was? Did he say 2 black guys?
Yeah, basically it said 2 black guys in an
Yeah.
Adidas suit, and the whole city went psychotic.
Right. Yeah. Well, it was a bad move. It was disastrous on his part, of course, all around. He ended up jumping off the spoiler alert.
Tobin Bridge.
He ended up jumping off the Tobin Bridge. But yeah, it was interesting how there were 2 levels to it. It was this absurd, outrageous scam that he kills his wife and then shoots himself to fake a robbery, and then on top of that, he has to bring race into it by saying it was 2 black guys. And so, but I started watching the doc, and then I thought I kind of know this story already. But it sounds like you're saying to me there's stuff in there that is new or looking at it a different way, or what?
We're Bostonians. We are Jewish, but we do have white skin. So we know how the 70s were here in Massachusetts, especially here in Boston. I remember I lived in Milton on the edge of, the Red Line district of Boston. Boston's got a lot of racism going on. It was right after Boston. They kind of frame it like in the aftermath of busing, and how,
Sure.
we have our own segregation up here because it's part of the American story, really. And if you don't face it, then you're not going to fix it. And that, everybody, and they're mostly men in power, white, this white men, Irish world. This is where we live. And they were all in power politically. And they just couldn't see, this is about blind spots. They just couldn't see that someone who looked like them and talked like them and whatever would ever do something like this. You know what I mean? Because Kevin White went after them. And there were some black leaders in the community who were like, step back. It's usually the guy who does it. Like if someone's getting, but no one was listening because they fell into this weird narrative. So
yeah. That documentary series is on the streaming service Max.
Yeah. So, you never find anything. Anyway, so it is called Murder in Boston. I think it teaches you a little bit about Boston history, kind of like makes you reflect if you were alive at that time, what you thought, because I didn't see it coming. I remember working with Black women in Boston. I used to work in affordable housing. And one of the women I worked with who, most of them lived in Roxbury or Dorchester. And they were like, the husband did it, like right when it started. And I'm like, really? They're like, yeah.
Yeah. And kudos to them for sniffing that out because it was this mystery. And then later, Mark Wahlberg did a song called Walk on the Wild Side, which was on the subject of this Charles Stewart case.
Yeah. So I think we've learned Boston's a different place now. It's also learning about that. Okay, Dave. All right, beginning 2024, we are booked through most of March, getting into April. If anyone's out there with an amazing story that I haven't heard yet, reach out to me. That's how we find our guest. And I'm looking forward to doing more of these in 2024. Oh, I did not talk about the hemp guitar. I have to give it a plug.
Oh, come on.
All right, the hemp guitar. It's in the newsletter. It's coming along. I'm putting stories about it. It will be done very soon. It's beautiful. It is made out of hemp wood. It has an inlay, like a opalescent inlay of a cannabis leaf, and he put a bowl in it so you can smoke out of it.
Music and weed right there. All at your fingertips.
All at your fingertips. So I am hoping to have it in my hands this spring. I'm hoping to connect with Nikan. Mark, I say this every week. Are you listening? And tour it around. Maybe we can bring Josh Lampkin up here to play it. We just were at the Broccoli Gallery, which would be a beautiful place for an event like that. Don't you think, Dave?
Yes. Fantastic.
So, all right, we're going to show up the hemp guitar. Somehow we are going to get it out there and it's going to work on policy stuff so we can help more women who are using cannabis and crushing the stigma and doing all the work that we're doing. So thanks, Dave. And now we're going to move on to today's guest. All right, today's guest is the Chief Medical Officer of Duber Medical, which is a leader in medical marijuana doctor consultations with a mission to educate patients on the medical benefits of cannabis. Duber Medical is a physician and woman-owned practice that works with diverse populations of more than 10,000 patients across 11 states, collecting real data of the clinical benefits of medical marijuana. Today's guest brings her more than 30 years of medical experience to the medical cannabis practice. She is board certified by the American Board of Neurological Surgeons, American Board of Independent Medical Examiners, and the National Board of Medical Examiners. Her career spans a myriad of specialties, including neurological surgery, trauma, complex orthopedic spinal surgery, and emergency medicine. and she's been a longtime proponent of medical marijuana and was an early supporter of California's Prop 215, which first legalized medical marijuana treatment in patients in 1996. And it was during her time as a senior neurological surgery resident at the local trauma center. She believes that medical marijuana is a viable and beneficial treatment option for many patients who seek to improve their quality of life through cannabis. Please welcome to the Cannabis Show, Dr. Gabrielle Morriss. Welcome, my friend. Thank you for joining us today. Okay, medical marijuana, medical cannabis. What do you feel? What are you talking to your patients about? Just start right there.
I use the terms interchangeably, and I use that as a starting point because I want each patient to individualize and know a little bit more about their strains and their terpenes and their preferences.
All right. So, and let's just start. Can we start with your cannabis journey? Maybe like what was your relationship with cannabis before jumping into it, this way? What did you believe it was? Like I always say, I thought it would kill brain cells. It was dangerous. And yeah, I was like concerned.
When I was a kid, I thought of it as a gateway drug. When I was in college, I was too poor. So I never really had much bias until I was a trauma surgery resident and then a neurosurgery resident. And I saw a huge difference between what happens with alcohol ingestion and patients causing themselves harm and injury versus patients who were using marijuana exclusively and not coming through the trauma unit, not wrecking their cars or getting assaulted. And so I really became interested in how the positive effect it had on patients. Then in my neurosurgery, I saw the benefits.
And what year was this?
Migraines at
what year was this? What year were you working in this? What year was this when you started seeing cannabis differently? Yeah.
I would say it was probably 1990 to 92 first in the trauma ERs in county hospitals in California. And then in the 93 to 95 era, there was grumbling in California. There was a movement, but definitely by the 95, 96 academic year when it was really publicized, that was an eye-opener to me because in the trauma unit, we did a toxicology screen and a BAL on every patient that came through. So you really had a clear cross-section, and people who had positive marijuana only did not come in through the trauma unit as victims of trauma or injury.
All right, so can you back up on that, the data thing? Can you actually, so is that something, is that true across the country in every emergency room? They do a toxology so you could tell the difference?
No, they do not. It was in that era because we were the first trauma 911 center, and it was part of our trauma panel. So it was not necessarily an organized study. It was my own observations because it was data we collected on 100% of the patients.
But that data exists. I don't know, just that the whole data, like we don't have data, we don't know what it does, is kind of makes me frustrated. That's interesting. All right, so you could actually see it before your eyes. And
because yes, you are correct.
And so what were your other like your other doctors, the people you're working with, what did they think of this? Did you bring it up to them? Was it an issue?
Oh, yeah. I thought it was a great idea. And I thought that we should investigate how it could positively benefit the violent gangs in Southeast San Diego. I was really very intrigued. People thought I was pretty radical at that time, but it passed. And then in that era, the teaching was that pain was a signal that there was something wrong, and it was our job as a surgeon to find the cause. Subsequent to that, a few years later, California passed the first law of pain is the fifth vital sign, and we must treat pain, with narcotics like water. And I was very vehemently opposed to that philosophically. And then we all know the opiate crisis ensued. Right. And I never thought the opiates did as well for controlling the symptoms, and they clearly took people down this negative pathway of higher and higher dosages of meds from less and less benefits with higher side effects.
So, Dr. Morriss, I just have a question. So, all right, so sure. We're probably similar in ages, sort of, whatever. And I remember the opiates coming in, and as a physician, I can see where the physicians are now. So in the beginning, you were saying this is wrong. The opiates aren't the good thing to be using. And, that's really frustrating. It's like, there are doctors who knew.
It was worse than that. No, we were demonized, and that we were inhumane and the patient's Bill of Rights. And, again, I'm a neurosurgeon, so I see a high proportion of patients with headaches and back pain, chronic back pain, and not every, opiates are not the answer, and long-term opiates are not the answer. And I never felt that was appropriate to just put a Band-Aid on it.
That's interesting. Okay, so I could talk about this all day, but I got to talk about cannabis. All right, so tell me about opiates. Tell me about what you're doing now, how you came to this medical practice. How many medical professionals are there? What does it really look like? Just tell me a little bit about what you're doing now.
Well, I am the leader of Geber Medical, which means I'm in charge of training the new physicians. And in some states, we actually have nurse practitioners that do this work and physician's assistants, but basically providers. And we are a group that does nothing but cannabis consultations for patients. So we are in 11 states, which means we have to do it's federally illegal, but legal per the state. So in each state, we follow the state-specific processes. But the bottom line is we're doctors that care about patients. We know the cannabis works. We know there are a range of products and a range of safety. So my mission on each appointment is to teach the patient how to use it safely, how to get the most benefit, how to listen to your body and see what medicine gives you the best for your symptoms with the least amount of interference, side effects. And, there are so many products. It's really exciting. And on the follow-up appointments, to see how well patients are doing a year later, my happiest patients are off medications, whether they're opiates or even just ibuprofen over-the-counter anti-inflammatories. Patients are thrilled to get rid of pills, to get rid of their demons, be it alcohol, be it other drugs.
It's amazing. I mean, it is amazing when you finally feel good. I think that's the thing that I hear over and over and over again is this idea that you just kind of you get used to feeling shitty. And then they find cannabis and they're like, what? I don't have to feel that way all the time. And it's like they're evangelized. That's amazing. So do you call yourself an endocannabinoid doctor? How do you describe what you do?
I just call myself a cannabis expert.
Okay. All right.
And I pride myself on individualizing. Not so much that every patient needs to know the entourage effect of the terpenes. I enjoy teaching the beginners who haven't touched it maybe since the 70s or who never touched it, and really showing them the range of, you can get pain relief without the buzz and you can still function. Conversely, you can have that euphoria and kick back after a hard day. If that's what's going to prevent your migraine and give you a good night's sleep, then I think it's far safer than a lot of the prescription meds out there.
It's good. I mean, that is the big drawback is we don't have a lot of medical professionals who are working with patients. And I tell my mother's story all the time. Like my mother just didn't believe me because her own doctor couldn't help her. And I'm not a medical professional and I literally have no idea how the human body works. So how am I supposed to describe this? And if you only really have a bud tender talking about products, you're not talking about the other things. So why it's so important to have medical professionals, which we're talking to today, who are invested in this and can help us understand how it works. Yeah. All right. So
absolutely.
So what kind of patients are you seeing? What's the range of people you're seeing?
Well, we only see adults because pediatrics is, even the teenagers, adolescents is a whole different ball of wax.
Mm-hmm.
But we are predominantly a telemedicine practice. We have a few exceptions. One of our states requires one in-person visit for a first appointment. But in general, we do telemedicine, which we find helps a lot because people are very stressed. You spend your whole life thinking it's illegal, bad, you have to be ashamed and hide. And yet here I am. I want to hear all your true feelings, all your experiences, because if I'm going to guide you to make the best choices in that dispensary, I need to know as much as I can about you, both your personal cannabis experiences, but your medical history, and what worked for you and what didn't work. So having that dialogue and having you at ease on your own living room couch on telemedicine on a video appointment, I think is very, very helpful.
That is a great approach. This idea that and we talk about this, crushing the stigma. There's so much stigma. People don't even know where the stigma comes from. I have spoken with, when you need to be nurses out here who do the medical card for Massachusetts, how people will come and wander around the parking lot because they're so nervous to come in. There's a lot of discomfort and people don't even know where the discomfort comes from. So that's a nice idea that you could do it. But, now that's been normalized by teleconference. Yeah, with your doctor. Okay.
And go ahead. Sorry.
No. Keep going.
Well, I love the fact that we can talk about it. And you fill out their history for us in advance, much like when you go to any other doctor, all that dreaded charting you do and you answer a bunch of questions. But the reality is that helps me clear out what's pertinent, because again, the patients don't generally know what I'm going to be asking. So when you do that little bit of homework in advance, it's a very different approach I'm going to take for someone that has, for example, Crohn's disease as an isolated complaint, but has had a multiplicity of surgeries and needs their cannabis for that, versus someone who uses it for fibromyalgia or glaucoma. So it really depends, on the individual. So the more knowledge I can have in advance, the better our conversation can be.
And are you able to communicate with other people's doctors and nurses who are working with them in more traditional settings? Is that a thing? How does that work?
If the patient requests that, we are more than happy to do that. What we've found, though, is most of the doctors generally most of the primary physicians don't do cannabis, and the same thing with the mental health providers and the chronic pain management. But what we find is that if they're pro-cannabis, if they encourage their patients to have it, they encourage their patients to see a cannabis doctor as well. So if you're in both supervised programs, you do better.
That's I think that's kind of hopeful. I think the cannabis, I talk about it like it saves everything. I know it doesn't, but it's a tool in the toolbox. And now, as it's becoming more mainstream and doctors can talk about it. And I have a friend who's having some treatments for cancer, but she's not allowed, or she hasn't even tried to use cannabis. And because I don't know, it seems like it's a lot of options out there, but no one in the medical community necessarily is talking about it unless you ask about it. Yeah.
Well, it's a field of knowledge, and I really don't think that the average business clinician has the time to learn it or the time to, quite frankly, talk about it with patients. Think about how fast your regular appointment is with your regular doctor, and how many medications do you get renewed at that one super quick visit every so often.
Yeah.
And I ain't got to spend the time to really teach you just about this one medicine, but it's got all these different flavors. And like you said, it's a great toolkit. I teach you to put your favorite tools in it, and then you know when to use them.
It's a good way to think about healthcare for ourselves. All right, can you just share a story of a patient who maybe even you were surprised how well cannabis helped them in their healing journey? Have there been patients who've come in, I'm sure it may not have worked for, patients it's worked better for? Just maybe some stories that of what you've been seeing lately.
Well, I will tell you the trends of overall happiness, I kind of alluded to one, and that's people love the fact that they can get better symptom control with cannabis products and then get off traditional medications, whether it's prescription pills or over-the-counter pills. I had a patient the other day who was thrilled because he's had chronic back pain his entire adulthood. He's in construction, and this is the first time he went for a whole year without needing any injections in his back. And normally he gets 3 a year, and that was really fun for him.
That's a good one.
Every day I hear great stories about people avoiding alcohol, prescription meds, or street meds, street pills, street narcotics, street drugs, or alcohol even, just avoiding their demons by having better symptom control, by having a cannabis product that they use, and yet they're functioning. And then probably my favorite group I love seeing currently are my young women with PTSD. There's kind of a trend. They come year one, they may or may not have used cannabis, but they're obviously at the bottom of or near the end of their rope, unhappy, needing a lot of help, willing to try something non-traditional. And then when they come back for their first renewal, you see this light in their eyes, and they're excited and they're animated, and they're telling you how much better life is and how symptoms are better controlled and what they've learned about cannabis. And then year 3, which is their second renewal, then it's always, oh, hi, doc, I just got a master's degree, or I got a promotion, or I got remarried. Oh, my kids and I have so much better of a relationship. And it's so fun because I can almost predict it when I review a chart with PTSD a couple of years in, that they're going to come to that camera and they're just going to have this, spontaneous, great stories to tell me because the disease is no longer controlling their lives.
Oh my God, I get chills from that. I think I was hearing something today about stress, like how stress when you're very stressed, you hold on to negativity. And everyone knows that if you focus on the
Yeah.
negativity, you create that you basically manifest a negative world. So the idea that you could take stress and pain away from people, that opens them up to not being focused just on the bad stuff, that's like a miracle.
It's amazing. Like I said, just I get this little grin, and maybe that's sick, but when I see a young woman coming back for renewal with PTSD, I know they're doing great, and I know they're going to have good stuff to tell me, and I know that they're proud of themselves. And earlier you made a comment too that this population tells me frequently what they like, and a lot of patients what they love about cannabis is I get the comment routinely, I can feel my feelings again. Rather than the psychotropic meds where you're kind of zombified, you really get to feel your ups and downs and cope with life. So I think it gives patients that control back. It's very good for mental health for all of us. Even if your primary diagnosis is not psychiatric, good mental health helps good physical health.
That's wow. I hadn't even thought about the whole feeling emotion about it. Yeah. All right. So let's move on to my very favorite topic, motherhood and cannabis. I know out here in Massachusetts, one thing we're talking about this year, fighting back on is, doing the drug test on the baby's meconium and then including children's services when there isn't a fear of abuse, but just because they do it. And there's no reason because cannabis is legal and, it shouldn't be tested and it shouldn't be, women shouldn't be afraid to use cannabis during their pregnancy because they can get involved with children's services. So where do you see, and again, I talk about motherhood. I did not use cannabis when my children were young. I probably should have. I would have liked them better. I would have been more relaxed. I would have had some of that stress and I probably would have felt better, like understanding how stress works with like not feeling well. So
Yeah.
What are you seeing where your practice is? Are you having mothers coming in? Yeah. Yeah.
The simple short answer is that your simple point that you made as a lawyer, I couldn't agree with more, and that is it's absolutely outrageous to be testing the asymptomatic babies and the asymptomatic mothers, period. Period. End of that discussion. That should not be happening, even in states where it's not legal. If there's another CPS, Child Protective Services issue, then that's a different ballgame. But like you said, the average Joe, that should not be. Now, this being stated, motherhood versus pregnancy, I see those as two different answers for cannabis because, as you said, for motherhood, I definitely think it's the safest of your options as mother's little helper. I think it's the safest for moms to use something to treat their stress, to treat their symptoms, and to be a better mom. So I encourage that. I think it also helps the anxiety, and I think it helps during postpartum. But I will tell you, during pregnancy itself and during breastfeeding, across the board, I'm a neurosurgeon. Very simple. 35 years, I've just told all women no to all meds during pregnancy because it worries me. It's a common sense thing. And so I don't look at cannabis differently than I look at Tylenol. Any pregnant woman in my practice, I have always 100% referred to the obstetrician. Now, and that's like you said, even with vitamins, and even though B6 is now the popular instead of Zofran, when it's a pregnant woman, I defer to the pregnancy expert. This being said, I am thrilled to report that over the years, there are definitely obstetricians who clearly encourage it, who would rather have their patients using cannabis than having the dehydration and electrolyte shifts of hyperemesis gravidarum. There are also, obstetricians that encourage it along all the way through for their patients. And I have a few OBs that actually will do their own prescriptions, recommendations for their patients during the pregnancy, and then they turn them back over to us. So while my personal between you and I when you're pregnant or breastfeeding is going to be, I don't recommend it. If you feel strongly about it, I'll work with you and your doc to help you figure out how to minimize the risk, how to do it the best works for you. After you deliver, then you're back in my comfort zone. But during that pregnancy, I always defer to the gynecology obstetrician specialist.
That's smart medical advice. And I've spoken with women with the I can never pronounce it, hypernemesis gravitatis. Yeah.
You're close.
Yeah, close enough.
Too much vomiting.
Yeah, and I will say my friends who had that were, in the hospital taking medications, getting hooked up to IVs, and these women have discovered that, cannabis is helping them not be nauseous. So they're advocating for that instead of the other medication. So I've seen that story out there. And I mean, the one thing I do think of, like you were talking about data, they did the drug trial, or they checked people when they come in. And if they did that with women, if it was okay for women to consume in a legal state, if they had medical cards or whatever they want to, verify it with, and then you would have data and you could follow those children too. So I don't know. No one's going to do clinical trials on a pregnant woman, but if a woman is using cannabis, you should get the data from her and follow her kids, see how it's going. That's what I think.
Absolutely.
Yeah.
We've learned tons from retrospective observational studies over the years, decades, and centuries.
Yeah,
it's one form of data acquisition.
Yeah. So there you go. There's my little plug. All right. We're going to come back. We're going to talk a little bit more about motherhood and cannabis and all sorts of stuff with Dr. Gabrielle Morriss after we take a short break, because we're going to share you my friend Lisa Capitani's newest venture, Mindful Cannabis Consumption Journal, and how she can help all of us make the most of this plan for our own health and wellness. So Dr. Gabrielle will be back in about 10 minutes. And welcome, Lisa.
Hi, Joyce. Thank you so much for having me on your show finally.
Yeah, we were pandemic friends. We've gone way back. She's been in Boston. All right. So just tell me what, I know you were talking about Weed Week. I think that's now, which I'm going to miss, but Mindful Metrics, Conscious Cannabis Consumption Tracking Journal. I think it probably ties in really well with what we've been talking about with the doctor today.
Yeah, this is a perfect segue. Really respect Dr. Morriss and the work she's doing, and agree so much with so many of the points that she's made already. So this was my proof copy of Mindful Metrics. I started the beginning of last year publishing Weed Week, which is a 7-day journaling challenge for the regular cannabis user who is interested in taking advantage of sort of the consciousness expanding potentials of this medicine. And through people's experience getting to know me and the journal, I've had a lot of people ask whether I do a more traditional tracking journal for the medical cannabis user. So this past year, my goal was to do that, and it was published on the 28th of December and went live Monday on Amazon. I'll have it available on my website very soon.
Link will be in the show notes, always in the show notes.
Of course. It's a smaller book than Weed Week, so a little bit easier to carry around if you're not always using your medicine in the same place. And it does just have the standard tracking where you record your product, the dose, the symptom score before and after, and some other details around, the terpenes that are in it, the smell and taste of it, the effects you feel from it, so that you can gather data. I really think it's important when we're working with a medicine like cannabis that is so individualized and so customizable that we record data. If we don't have data, we can't track, we don't know what to change.
Yeah.
And in addition to there's 100 pages to record those sessions for the user of the journal. And every 10 pages, there's a blank page to record any reflections and observations you might have of the previous recordings. And there's 10 different mindfulness activities interspersed throughout the book that pair well with cannabis use and introduce folks to the idea that we can go a lot deeper than symptom control with cannabis.
So is this a PDF or is this a book? Like, how do people purchase this? How do they get
Mindful
this?
Metrics is a physical paperback book available on Amazon, and I will have it shortly on my website. It is $14.20.
And it's and I did the Weed Weekly when you first developed it. And it's, again, I kind of had notebooks, and I do think it's a little bit tricky, especially we're going to come back with Dr. Morriss, but she's helping her patients find products, but there's so many products out there. And I'm just talking about cannabis strains and just the idea that you can smoke it, drink it, eat it, rub it on yourself. I use patches now. I use patches on my back. There are just so many other ways to help yourself feel better, and there's a lot of things you have to remember, and you can, so to be able to have a place like a log instead of like in your phone, or maybe something, and then really like look back on it, because that's what I like about journaling. What do you think is the power of the journaling?
Well, like I said, you can't change what you don't track,
right?
And journaling helps us to really be able to recognize patterns.
Mm-hmm.
And as humans, that's what we're designed for. We recognize patterns. And when we can recognize those patterns in our own behavior, we can change them, you know? And I think that what cannabis does, it ties in really to the psychedelic qualities of cannabis, right? Where under the influence of cannabis, we can look at these maybe dysfunctional patterns of behavior without the same amount of judgment that we have for ourselves in our normal thinking mode. And so Weed Week especially is designed for that. It's designed for getting really intentional about your cannabis use and delving into how you can use cannabis as a tool in your path to healing, whatever that means to you. One of the most exciting things I do with Weed Week is the week-long live challenge.
Oh yeah, do that. Talk about that before. Yeah.
Sure. So I'm going to be doing it again starting January 14th through January 20th. It's the last time I'm probably going to do it in this format at this price of $50. That includes a paperback and a PDF copy of Weed Week in case you don't get yours on time. And it's really centered around my process of healing, which is a 4-step process of awareness, understanding, change, and healing.
And you've done this before, so what kind of things are you finding people are coming to you for? And
sure.
Yeah.
Folks who have completed the Weed Week Challenge have had a pretty wide variety of outcomes. I've had one user who decided she was on the wrong career path and made a change in her career. Another who decided she was ready for a change and moved, moved to a different city. A lot of people find that it helps them introduce a new practice like yoga or meditation because they take the time to be intentional about it in the beginning and reflect on the positive outcomes of using that practice. And it just makes it a more seamless transition to introduce something new. And probably the most common outcome that I've seen is people who recognize that they have some problem cannabis use happening and are able to acknowledge that without judgment.
That's an
And
interesting benefit that I wouldn't, because I have seen people talking about the breaks and the different things and how to consume it more consciously. And because you can, as a cannabis consumer, you can become very unconscious of it, just especially since it's very accessible now. That I guess that would be the flip side of what's happening with legalization. Yeah.
Yeah, she's a tricky little thing where we can forget the power that she has and sort of let it be an escape, let it kind of numb us out. And so that's why I introduced this idea of conscious use and intentional use and how important that is to maintaining a healthy relationship with the plant. And that's what really has borne out the experience of doing these Weed Week challenges. I've recognized the importance of having support for problem use, having support for intentional use, and the community around that.
Well, I think that is not what they like, even like relationships. That's like the whole point of it. Like without relationships, you can't be happy. And I think a lot of times what I've heard, I kind of late to the game, but a lot of times cannabis consumers felt isolated, and specifically moms were very stigmatized. So you couldn't commune with it, which is literally the purpose of the plant is to help you have better relationships. So I love what you're doing. All right. So let's give everyone a plug for your website where they can find your book. And this podcast should be out around the date. So hopefully you get a couple more people to sign up. So just give them a big plug, Lisa.
Sure.
Oh, actually, no, before I want to do that, just kind of tell your own story. Like, what is your journey like? Quick, can you just, you're a nurse, but like how you got here. Quick.
All of this came about because of my own experience. I've been a long time recreational cannabis user, and that's how I always looked at my use. I became a nurse in 2005. I worked in the emergency room. And in 2010, I was in an accident where I suffered traumatic brain injury, several fractures that left me with chronic pain, and I developed PTSD. And for a decade, I struggled in the healthcare system to recover and rehabilitate from those injuries. But it wasn't until 2020 when my health started to really decline again under the stress of the pandemic that I took a look at cannabis in a different way. I learned that there are cannabis nurses, and that set me down a path of finding all that information, all that research and data that I was always told didn't exist, but it did.
Mm-hmm.
And I finally started to really heal. And that gave me, something I felt I could keep being a nurse with, a real tool I could use to actually help patients, which I wasn't feeling was the goal in the healthcare system anymore. Having that system fail me as both a patient and an employee,
Mm-hmm.
I was really forced to look at other options and really reinvented my relationship with cannabis. And I found that as I used it to control the symptoms, the anxiety, the stress from the PTSD, the pain, what that did was create space.
Yep.
And in that space, I was able to see possibilities and see places I could make changes in my life and get to know myself in new ways that were much more fulfilling than the sort of walking around with blinders on that I had been doing for a decade before that.
And now you're like one of, again, all the ladies I talk to, they find this almost out of desperation, often as a last resort, and they are evangelized and they become the people they needed, which you have. So give the plug for your website and how they can people can find your book if they want to, journey more consciously with their cannabis use, or actually are starting for the first time and just need some place to keep track of what they're doing.
Sure. So my website is lisacapitani.com. You can email info@lisacapitani.com anytime. That goes right to me. On Instagram, I'm CT_cannabis nurse. And the Weed Week book and challenge are available on my website. If you sign up as soon as you hear this show, you'll likely get your book in time. If not, I can send the PDF. And if you use the code The Canamom Show, all lowercase one word, you get a 10% discount off that. Mindful Metrics is currently available on Amazon. Hopefully by the time this show airs, I'll have it in my web store, but if not, it'll be available there very soon.
All right, and all in the show notes because that is what we do. Thank you, Lisa, for joining us today. Thanks for sharing this. And people make all sort of resolutions in the new year, so this is a good one to keep more conscious cannabis consumption and find a way to heal because we all want to be healthy in 2024. All right, we are back. Let's see, we got a few more minutes. Dr. Gabrielle Morriss, we're back. Let's see. So when you went into cannabis, what did your family think?
Well, they love the fact that I went to what we call happy medicine versus the high stress world of neurosurgery. So very, very happy to see the changes. And I've always been a teacher. And so now I'm getting to go to cannabis conferences as a speaker and travel for teaching cannabis instead of just neurosurgery. So it's really exciting. Surprised it came this far this fast. As you know, I voted for that first Prop 215 in California, and here we are already in 38 states. Pretty amazing.
It's come a long way. It's a tipping point. I kind of say it's like the Venn diagram of life. Everyone's got some pain and issues, and it's not the devil's lettuce. Once people realize what it is, they evangelize for it. These stories, like the small stories. Do you see this? It's like the people you're serving are helped, and even if people in their life think it's bad and dangerous, they see this loved one who's feeling better, and they can open up their minds a little bit and be like, maybe. Have you seen that?
I love it. And I love when I have adults bring their adult parents or their adult children in later, or a spouse that gets their card a week or two or a month or two after the spouse because they've seen the benefits. I love hearing the happy ongoing stories. Yes. And essentially that's what all our renewal appointments are. People talking about how positive the impact is on their life. It is very rare patients that don't get adequate pain relief or adequate help from it.
So I know that. So are you still in California? Where are you now located?
Actually, we are based out of Ohio, but in the process of moving to Tennessee.
Oh, Tennessee. My son's in Tennessee.
But
all right.
California is where Tennessee doesn't have cannabis. So again,
well,
because
technically Tennessee doesn't have cannabis. I've been down there a lot.
Yeah.
It's everywhere.
They do not have medical cannabis laws for us.
Okay. But I was going to ask you, so how do you, again, this is a state-by-state issue. All the products are in-state, no interstate commerce. So how do you talk to patients about products? How do you find out what's out there? Do you sort of give specifics? Are you more general? How do you talk to people about what they should be using?
Well, again, I try to individualize between, first of all, their background level and experience and exposure to marijuana. There's a whole range of experience out there. I'm not going to talk to the novice about the terpenes, and I'm not going to talk to the expert about sativa, speed up versus indica couch. I got to individualize it. But in general, I am not brand loyal, or I like to teach the patients the concept so they learn how. I tell them they got to learn how to read that label and choose what's best for them.
Oh, that's interesting.
And build your own toolkit. So I like to take the approach that life is different on different days. You've got to figure out whether the pros and cons of each. I think my happiest patients combine what I call the rapid onset of action agents, or anything inhaled. Anything inhaled is going to kick in fast, right?
Mm-hmm.
It's going to wear off fast. So most of my happy patients like something in the inhaled category and something in the long-acting category, like the edibles and the tinctures. And once I get to where they are and how it fits their lifestyle, then you're right. I got to individualize that. Pennsylvania doesn't really have edibles. They got capsules. Ohio will let you dry or vape, and they'll sell you the flower, but they don't want you to smoke it. So there are different nuances depending on where I'm speaking to the patient.
And do you do dosage? Like, I know, like medical, so edibles in Massachusetts, if they're adult use, they're 5 milligrams, but if you get it from your medical side, they could be higher. So do you talk to people about, I know it's always low and slow, but do you start at any dosage expectations?
My favorite is, I like the math is easy at 10 milligrams. I tell people buy 10 milligram edibles, and if they're microdosing, I have them cut them in quarters for daytime use, half for nighttime use.
Oh, that's smart.
But yeah, I do. And again, it depends on what your medical, it's very different what you're trying to treat. Why are you not sleeping? Because you have night terrors from PTSD versus you've got restless legs that just won't stop jumping. Those may require two different cannabis products. Also, if someone's an asthmatic or someone who just recently quit smoking cigarettes, they're not going to want anything inhaled. So I try to teach people categories so they have the tools to figure it out.
No, that's smart. That's a smart way of
hung up on this strain.
Yeah, I get it. It's like, there's a lot of products out there. There's a lot of ways to ingest it, consume it. There's beverages, ice cream, capsules, pills, smoking it, vaping it, you can make your own edibles. I have a patch. I've been using a CBD patch on my back, which actually is really good. There's a lot of other, I guess it's just like any other medical issue. And I talk about cannabis. Everything in cannabis is like the real world, but upside down. And you need a specialist because it's everything specialized. And this is a specialized medical facility that is working with patients, and you have a lot of knowledge about what all these different products are, and can really talk to patients intelligently, and then giving us some ownership. I think that's the best. That's like good parenting.
Yes, and I think that's the important thing. We also have educational videos on our website that are more, current events, current trends in cannabis. But then on our YouTube channel, we have the very basic beginner series for essentially the adult who may go to college, maybe not, hasn't touched it in years. Maybe they've called it the devil's lettuce, but now they're really ready to try it. So we have short videos for just beginners. So that's another thing I try to steer patients. If you're a beginner, you want to go to our YouTube channel. If you're what you consider an advanced user, you've never had access to a dispense, you want to look more at the videos and the articles on our blog or on our general website. So, it does matter what your exposure to cannabis is as well.
Oh, absolutely. So again, Nashville, I think, is or Tennessee is an interesting example. My son's down in Nashville, and they sell cannabis everywhere. It's bizarre, but there's no medical or adult use program. So you got to know what's going on in your state. This is really very true.
But that's all CBD in Tennessee, and which I don't understand how they can label it that, but it's all CBD products at the bars.
I don't think it is. I bought flour that they say it's THCA, which is basically the non-decarboxylated cannabis, and that's the law. And I'm like, that doesn't even make any sense.
Well, I'll tell you, I will soon be researching Tennessee in more detail. So I will learn it.
It's going to be whatever. It should just be an option medically across the board with everyone. So that's my theory. All right. So what do you we're all 2024 in the medical world. I know you're doing more conferences. You're out there speaking. You're talking to people. What do you see? Any breakthroughs at this coming up in this year that maybe we're not already aware of?
I am hoping to bigger and better and broader acceptance, mainstream. We're still fighting a lot of stigma. One of my personal goals would be to get the stigma you alluded to, get the stigma through the heads of the medical professionals. Right now the psychiatrists and the pain management doctors support cannabis use. The gastrointestinal doctors are supporting it. But we need more mainstream doctors saying, hey, to their patients, I might not know enough about cannabis, but I know it helps some people. Why don't you go talk to a cannabis doc? I would like to see that. I'd like to see more conversations around the dinner table of, Grandma, it's not going to get you all schnockered, but it is going to help your knee a lot.
Mm-hmm. What do you think? So again, I mean, the medical profession, what do you think is holding it back? Are they not talking about the endocannabinoid system in medical school? Like, this is a system in our bodies. They teach you about everything else. Why wouldn't they talk about this and how this medication works with it? Do you see that?
It's mentioned in passing because it's mentioned in passing. It's not a prescription that is common. It's that whole federal versus state, and here's the other piece. To be a physician, to practice medicine, you have to have malpractice insurance, and most of the large groups in medicine just simply won't, and you have to do extra certification and training, will not pay for their doctors to have the certification and training, and the majority of the malpractice insurance carriers will not cover you. So you have to actually have a second job, second employer, second policy to be able to do it. So that's a huge problem. It's not getting to the level of the physicians. You've got Cleveland Clinic Foundation, over 600 doctors aren't even allowed to learn about it or talk about it because the bean counters don't want to pay for it.
Oh, so much work to do. All right. Dr. Morriss, let's see. Duber Medical. If you're a listener out there, they want to connect with you. Someone out there is like their grandmother needs help. What's the best way to connect with them and connect with you?
Well, the easy way is our website. It's dubermedical.com, D-U-B-E-R medical, dubermedical.com. We're open 7 days a week. We have extended hours, basically with patients 8 to 8 in all of our time zones. We're in 11 states. For grandma who doesn't want to do the computer, just pick up the phone, call the toll-free number. Our nice people will talk her through everything. For your nephew who can wire the computer himself, he can log on and take care of it in moments. Any of you listening can use DuberMed, all caps, D-U-B-E-R-M-E-D, for $15 off for a new patient appointment or a return patient appointment. If you already have a card from another provider, we're happy to help you. The videos we mentioned, that's all free. You can go to our website. You can look at the educational. You can follow the links from our website straight to our YouTube channel. If grandma's not sure, thinks this might not be for her, let her watch a couple videos and think about it. That's all free. But we're happy to be here 7 days a week for our patients.
This is how we're going to change it. These nurses and doctors and people who are talking about this in a normalized way and changing the culture. So thank you so much, Dr. Morriss, for joining us today. And Lisa, thanks for joining us too. I love having these medical discussions. Again, cannabis touches everything from criminal justice to cosmetics. So here we are talking about on the medical level, and please reach out to these amazing guests if you have any questions, because again, I know nothing about the human body. So it's another show for my guests, Dr. Morriss and Lisa Capitani, and my Canna Bro, David Yaz, and of course our Canna Mom Show team. I want to thank you for taking the time to listen to the Canna Mom Show, where we are on a mission to enhance the impact women have on the emerging cannabis industry by sharing and preserving the stories of love, kindness, wisdom, and hope. Thank you for following and sharing these amazing stories. So together, we will crush that stigma around cannabis and caregivers. I'm your host, Joyce Gerber. This is the Canna Mom Show, and we're a production of Pod 617, the Boston Podcast Network.